Good afternoon, first and foremost. We hope you enjoyed your lunch and are ready for the important conversation that's ahead of us today. My name is Sarah Taysir Ben Sharif, and I'm a health journalist based here in Brussels. It's my pleasure to be your moderator for today's discussions, which focuses on how to raise the standard of care for chronic obstructive pulmonary disease in Europe, also known as COPD for short. It's hard to overstate the impact that COPD has on Europeans. It already affects the lives of around 36 million people in Europe, and if that figure isn't alarming enough, it's expected to reach nearly 50 million by 2050. In addition to the ways it affects the quality of life of those living with COPD and their loved ones, COPD is costly, both to patients and to healthcare systems. And it's why we're gathered today for the launch of the European Federation of Allergy and Airways Disease Patients Association's report, which is titled Raising the Bar for Better Standards of Care for Chronic Obstructive Pulmonary Disease. Over the next few hours, we're going to do quite a few things. We're going to take stock of where we're at with COPD care to draw attention to the progress we made. But we're also going to look at the lack of progress in some areas over the last decade to reflect on the key next steps to the prevention and care of COPD. I'd like to take a moment to thank our hosts for today, MEP Romana Jerkovic, and our co-hosts, MEP Tilly Metz and MEP Andras Kulja. All three MEPs are part of the MEP Lung Health Group here at the Parliament, which is newly reinstated and is currently recruiting for all those who are interested. And now, before I hand it over to our first speaker, IFA President Marcia Podesta, I just have a couple of housekeeping notes to get through. So first off, the event is live streamed, so a warm welcome to everyone joining us online. And second, we're going to do our very best to save some time at the end for questions, but we won't be taking any questions from our online participants, but we do encourage you all to interact with each other using the hashtag COPD Standards of Care in your social media posts. And just to cap off our housekeeping notes, I'll go over the agenda. So following Marcia's presentation, we'll have some introductory remarks from MEP Jerkovic and a call for action for lung health from MEP Metz. Then we're going to have our panelists join us on stage. We're going to do our roundtable discussion, and then time permitting, we'll have a question and answer period and some closing remarks. All right. So without further ado, let me introduce IFA President Marcia Podesta, who's going to highlight some of the IFA report's key findings and help set the scene for us for today's conversation. Marcia, you wear a bunch of hats. It would be impossible for me to list them all. But in addition to being IFA President, you're an attorney at law. And as IFA President, you advocate for patients with allergies, asthma, COPD, and you have over 20 years of experience in governance, managing a not-for-profit association, legal affairs, and EU and international health policy. So without further ado, please join me in welcoming her warmly.
Thank you, Sarah, and thank you all for your interest in this important topic. For us as patients, it's a matter of good life or bad life. To be honest, it's a matter of death and life and death. IFA is a patient federation reuniting 45 national patient organizations in 26 European countries, focused on chronic respiratory diseases, asthma, COPD, but also allergy and atopic eczema. We are here today to bring a hidden crisis to light. This is a wake-up call for COPD that affects 36 million people in Europe. It's too much. As you mentioned, COPD is the acronym for Chronic Obstructive Pulmonary Disease. It's a complicated name, as complicated the symptoms are for patients. You can imagine for patients is living like trying to keep breathing through a straw. And this disease is absolutely impacting their whole patient's life. So I don't know if you are aware that it's the third leading cause of death, not only in Europe, but globally. Despite this, it's very, very neglected. Firstly, because it's underestimated, underdiagnosed, or diagnosed when too late, when patients have already their quality of life and survival compromised, impacted irreversibly, negatively. And on the other hand, COPD poses huge costs for patients, families, and our healthcare systems, so for society. It is, well, we have numbers. We know that 6% of the total healthcare spending in EU is amounting to 38.6 billion euros annually. And with this huge cost and huge suffering for patients, COPD threatens the sustainability for healthcare systems and, believe me, beats families. But the sad news is that this is not new at all. Already in 2013, IFA published the first report on standard of care. So we identify at that time what our patient community considered were the minimum standards of care for COPD to be achieved in Europe. And believe me, those were the minimum standards. Now, more than 10 years later, we are here to present another report. So IFA and its community of member associations, we have explored the evolution of this COPD impact in our daily lives and what happened in the past decade. And the result is sad because this report highlights the need to break this cycle of neglect for COPD. This report is patient and science-based. It's not just something strange or only questions. Thanks to our member, we have identified some best practices, but unfortunately, we also found persisting gaps for patients that defeat health equity. And that's why we are here today. We are here today to ask you, members of the European Parliament, to help us, because this is an urgent call for action to COPD. We believe that, dear members of Parliament, we believe that you, the members we have elected, because we are patients but also citizens, we are doing our best to transfer our knowledge to you. Please listen to us. I think that you can do a lot helping our community, because this is what we need. We believe that you can take decisive decisions on health policies to improve COPD and prevention and care. And today our community needs, we have very clear what we want and what we need. So our vision for change has four interlinked, precise call for actions. First of all, we need to improve early COPD detection and diagnosis. As I mentioned before, this is a disease underestimated, underdiagnosed. That's why patients and healthcare professionals needs to be equipped with tools for timely recognize the pathology. So while we raise awareness on World COPD Day, we need an urgent call for action for early detection and invest more money in improved diagnostics for airways diseases. Our paramount, what is something simple. It happened yesterday and it's happening now. We want spirometries for lung testing as easy and widespread as blood testing. This is what we need. This is what we want. And this is what, well, our community wonder why is this not. So secondly, we need to ensure equitable access to COPD care in Europe. We advocate for standardized and patient-centered care. COPD is a chronic disease. It's not just a consultation. It's impacting the whole patient's life and their families, because when you live with a patient in your family, it's affecting the whole family and cost for families, for patients, and for society. So that's why we ask for standards that needs to be, how can we say, take the form of strategies and plans, European and at national level, to better address COPD disease. And that needs to include early diagnosis, follow-up on comorbidities such as depression, obesity, mental health support, because it's important, and a pandemic help, okay, and pulmonary rehabilitation. We need to tackle the respiratory disease stigma. We need to raise awareness on the real causes for COPD, not only related, and replacing misconceptions, because it's not always related only to tobacco. So please don't forget to strengthen public policies on health care policies to fight climate change and to improve air quality, because our patients with COPD are dying due to air pollution and heat waves. And finally, prioritize funding and research for lung health. Please match the investment in innovation with the real burden of for patients with COPD. We encourage the EU foster clinical research networks, centers of excellence, and enable high-end pharmaceutical and COPD research, putting always patients at the center. So just to conclude, we ask publicly, please, dear members of the European Parliament, work very close to patient organizations. Our only policy is keep breathing. By supporting patient organizations and working with us, you will change the healthcare decisions, and these decisions will be more relevant, more consistent, and more transparent for society. So we are experimenting a critical juncture for healthcare with raising needs and aging population. So investing now in COPD preventing needs to be better, but for the future. And well, we have here so many COPD patients, representatives, and patients in themselves from all around Europe and following online. I think that they would like to see themselves reflected in the EU policies. That's why we are really, really looking forward to the discussion. So thank you for your attention.
Thank you so much, Marcia, for your remarks and for sharing with us some of the key insights in the reports, but also your very specific calls to action. We're going to have a chance to discuss all of this further during our roundtable discussion. Joining us next is Romana Jurkovic, who is a member of the European Parliament from Croatia with the Socialists and Democrats group. Romana is also a medical doctor and a university professor at the Faculty of Medicine at the University of Rijeka. And within the European Parliament, she too wears many hats, including being vice chair of the Public Health Committee. And as I mentioned earlier, she is also a member of the MEP Lung Health Group. Please join me in warmly welcoming her.
Thank you. Thank you so much, Ms. Ben-Sharif and Ms. Podesta, for your introduction. And thank you, ETA, for organizing this important discussion. for me, as a vice chair of the Sun Committee and the medical doctor, it's a real honor and pleasure to be here and to be able to host this event today and discuss the urgent need to raise the standards of care for patients living with COPDs. And I must say right now at the beginning that I am really amazed to see how much your community of COPDs patients has invested into defining your own priorities for the national and the European level. And as an MEP, I heard your words really well, and I will keep in mind your needs and your inputs that I will hear today when making important decisions or voting on key health issues. As we heard, although COPDs are the fourth leading cause of death worldwide, affecting millions and millions of people in Europe, it still remained under-recognized and diagnosed, as you rightly said, on European and national political agenda. The findings of EFA's report confirm that despite the clear burden of COPD, there has been little progress in prevention in early diagnosis and care over the past decade. And this is not acceptable. This has to be changed. We don't have any more time to waste. And if we are serious about improving health outcomes and sustainability of healthcare systems, we must really act now. And over the years, treatments of COPDs have improved, but despite this medical progress, COPDs still remain an incurable disease. And this is why prevention is the most effective tool to combat with. And we can prevent COPD through better air quality regulation, smoking cessation programs for smokers, and early intervention strategies. Tobacco remains the leading risk factor, but it's not the only one. And I agree perfectly with you, particularly in Europe, where almost 70% of cases are linked to smoking. But we also must acknowledge the significant impact of environmental pollutants on this disease. And as a policy makers, it's our duty to implement stricter measures to reduce air pollution in line with WHO recommendations, limit exposure to harmful chemicals in the workplace, and enforce comprehensive smoke-free policies, such as recently published recommendations of the Council. And we must also push for the revision of the Tobacco Products Directive to address the rising threat of vaping and other novel tobacco products among youth. And I know perfectly that Commission promised to revise tobacco regulation, and we are still waiting. You know, I'm asking myself for how much longer. We have a good example, that's the Europe Beating Cancer Plan, which represents a significant opportunity to address also COPDs alongside lung cancer. Many of the risk factors for lung cancer, such as smoking, air pollution, and occupational exposures, are also key contributors to the COPDs. And studies indicate that many lung cancer cases begin as COPD, with long-term lung damage providing the conditions for cancerous growth. One of the key messages of EFA report is that early detection is vital to slowing disease progression and reducing mortality, and yet too many people remain undiagnosed until the disease is reached an advanced stage. To change this, we must promote lung health checks, improve access to spirometry, which is easy and cheap, and primary care and in primary care, and integrate COPD screening into broader health assessments for the at-risk populations, including smokers, people with occupational exposure, and those with related comorbidities. I am quite proud to say that the first early lung cancer screening program in the EU was implemented in my home country, in Croatia, in 2020. It is an example of how a targeted screening approach can contribute to the detection of COPD as well. But we must go beyond. We must go further. We need comprehensive lung programs across EU that integrate COPD detection into broader public health initiatives. We all need to breathe, aren't we? So this is, I think, very important. Moreover, early detection should be an angular piece of any action on COPD because it saved lives. As recommended in the report, I fully support the call for EU-wide studies on the cost effectiveness of early detection to provide strong evidence to policy action. However, for diseases like COPD, detection is just a start of a long patient journey. And it is our duty as MEMPs to support patients with policies that allow them to have their best life possible. And this is why in this EU mandate, I anticipate reflecting on the demands of your community in two directions. The first and very important one is to improve access to care. Yes, some European countries have quite comprehensive management plans, but there are many European countries which are lacking still the basic diagnostic and treatment infrastructure. So we must address these inequalities because all patients, whenever they live, they have right to a timely and effective care. So yes, we have to work on the revision of pharmaceutical legislation. We must reduce medicine shortages and so on. That's the task of us, policymakers. And the second thing, which is very important, and you, Marsha, mentioned it, it's we need to address environmental determinants of the health. I'm talking about rising temperature. I'm talking about air pollution and extreme weather events, which are worsening respiratory conditions and lead to more frequent hospitalizations. And this means not only to reduce air pollution, but also to ensure that our public health care system will be prepared to respond to climate-related health threats. And finally, we need to address the elephant in the room. While research is one of the most crucial elements in the fight against COPD, recent budget cuts to the EU for Health program raise serious concerns. We cannot claim to prioritize public health while simultaneously reducing funding for programs designed to support it. As negotiations for the next multi-annual financial framework already started, I will continue fighting to secure more funding needed to drive innovation and improve patient outcomes. And to finish, as policymakers, we have duty to act and to work together. There is still a lot of work to be done for improving COPD policies in Europe. COPD patients cannot afford another decade of inaction and waiting. The S&D Group will continue to place patients and patients' organizations representing them at the forefront of our policies. I can assure you that. I want to congratulate EFA for its continuous advocating and for bringing this discussion today in the European Parliament. Thank you so much for that. And let us work together to ensure that COPD is no longer a forgotten disease, but a priority on the EU health agenda. So let's keep breathing together. Thank you so much.
Thank you so much, Romana, for your reflections and for highlighting some of the key recommendations that could further improve COPD care, such as prevention and improving funding for research and for care. Our last speaker before we move on to our roundtable discussion is Tilly Metz, who is a member of the European Parliament from Luxembourg with the Greens and European Free Alliance Group. She's the first vice president of the Public Health Committee here at the European Parliament, and she has a particular interest in how the environment affects human health. Though she wasn't able to join us in person today due to some scheduling, she's very engaged for patients and is joining us remotely today with a video address. So let us watch.
I am Tilly Metz, a member of the European Parliament from Luxembourg. Lung health is a topic very close to my heart, and I firmly believe it deserves to be taken more seriously and addressed more effectively at the EU level to help us all keep breathing. Stronger lung health policies can positively impact everyone. They can significantly improve overall health and enhance the lives of millions of people across Europe. There are many reasons for this. For example, chronic obstructive pulmonary disease, COPD, is the third leading cause of death globally. Yet, many people are unaware of what it is. It remains underdiagnosed and absent from political agendas, leaving both the disease and those living with it shockingly under-recognized. However, COPD is very real and it will persist if no action is taken because there is no quick fix. The good news is that COPD can be prevented. For instance, tobacco use and exposure to smoking products are by far the leading causes of COPD. It's crucial for the EU to advance policies that further restrict smoking, diversify measures beyond taxation, and invest in well-resourced and accessible smoking cessation programs to help people quit effectively. Smoking, however, is not the only risk factor. The air we breathe also plays a role, as exposure to air pollution significantly contributes to COPD. Therefore, the EU must address both indoor and outdoor pollution. And by doing so, the EU can significantly reduce preventable hospitalization and deaths caused by COPD. As members of the European Parliament, we have a unique opportunity to push for impactful policies. I want to focus on three key recommendations. First of all, the EU should support the collection of robust data on COPD. Second, it should assist in identifying best practices in primary care and help member states implement them effectively. And third, the EU should encourage learning through the establishment of centers of excellence and the piloting of digital health management systems across different member states. Improving lung health should be prioritized alongside other EU health initiatives, such as tackling cancer, mental health, and cardiovascular diseases. I am committed to urging the European Parliament to include COPD in the EU's health policy agenda. Together, we can build a fairer and healthier Europe with respiratory patients on board. So thank you very much to the European Federation of Allergy and Airways Disease Patient Association, IFA, for giving me the opportunity to speak on this pressing issue. I look forward to learning more about the outcomes of the European Parliament Roundtable. Wishing you all a good day and all the best.
Thank you very much by distance, by video, to MEP Metz for her address and her excellent, very specific recommendations as well. Please join me in thanking all of our introductory speakers before we move on to our panel discussion. Thank you very much.
Thank you.
All right, it is now time for our panel discussion. So I would like to invite our esteemed panelists to join us on stage. We have with us András Kulia, who is a member of the European Parliament from Hungary and who is with the European People's Party group. And he is also a member of the MEP Lung Health Group. Thank you for joining us. We also have the pleasure of being joined by Paula Duarte, who is Vice President of the Portuguese Association of People Living with COPD and Other Chronic Respiratory Diseases, also known as Respira. And last but certainly not least, we have with us Svetlana Atanasova, who is Project Manager at Eurocares. And though she wasn't able to join us in person, we will also have with us by video at the end of the panel discussion, Marianne Taki, who is Acting Head of Unit for Disease Prevention and Health Promotion at the European Commission's DG Santé. She's going to speak to us about what the Commission can do to improve matters over the next 5 years. All right, we have about 35 minutes. Let's dive right in. And a reminder that if time permits, at the end of our panel, we are going to be taking questions from the in-person audience. So I'm going to start to my left over here. So I want to start with a key part of the puzzle, which we've heard a lot about, which is diagnosis and timely diagnosis. We know that having a timely diagnosis means that patients can access their treatment and their care sooner, and that this can have a tremendous impact on their quality of life. So my first question is for you, András. How can specific EU policies and initiatives help us improve early detection of COPD, given we know just how important it is to have that timely diagnosis?
Yes, I fully agree that timely diagnosis is a crucial question, because sooner we have a diagnosis, more we can do. And I think that's one of those topics where the European Parliament can do something. Now we have the SENT committee as a standing committee with a full legislative power, as we just heard from our vice presidents, and we can use this to highlight some very important issues, and also on legislative level. We had the non-communicable diseases report and the Health Together initiative, which also mentioned chronic lung diseases. And I think there is big space to do more, because it's a very complex topic, as just Romana highlighted. There are many different layers, and what can we do? And how can we get diagnosis? I think we have three very important pillars: the education, health literacy, and it not only means that health literacy of our patients, but also educating our primary care doctors. Okay, they are specialized and very highly qualified doctors, but also it's very important to have a harmonized system to have in every member state new educational blocks to discuss important topics with and highlight important topics for primary care doctors. Also to introduce to them the new improvements in these territories. The second big pillar is the screening system. How can we improve our screening systems? And the third pillar is the integrated care. What can we do when we have a screening and a diagnosis? And EU level will have the European Health Data Space. I think it's very important because with European Health Data Space we'll have the data of what we need. And also, for example, I'm coming from Hungary, and Hungary has so many problems with healthcare system, and it was one of my motivations to jump into politics less than 1 year ago, so I'm very new here. But in Hungary, I can see all the data, all the medical data, the receives, everything of prescriptions in every working place or workstation in any city or village in Hungary. And during the COVID, this was very important because I could read all the health records of unconscious patients. I could check all the medicines, and it was sometimes a question of life or death, because it's very important to know what medicines our patients take. But with EHDS, we can use the new digital technologies to find different patterns, to find the vulnerable populations in our member states. Also, with the medical device regulation, we know that we'll have a revision, and the EPP group asked for this to make this in the first 100 days for our new commission. But we'll see. I hope that it will happen in the next 2 years, because what we see with medical device regulation, it was very strict, and the new products, the new certified products decreased by 33% since we have the medical device regulation, and also we have to recertificate every available device, which means 80,000 devices, even the basic scissors. So it's clearly need a revision, and with revision we can put on a fast track the new innovative tools which can help to get a sooner diagnosis, also to use new, even the digital solutions, because we need to see this. And only two things: the Critical Medicine Act I would like to mention, but maybe later, and also the formal legislation, because it's not enough to have an early diagnosis, and I know the question was about the early diagnosis, but to act as soon as it is possible. So I think on legislative level, the reports like the Healthier Together initiative, the environmental topics, to see where is the most polluted the air and the tobacco usage, to have those vulnerable populations, to focus on them, and also with new devices, with new technologies, we can foster these advantages, and we can help our patients. And last sentence, sorry for that, but education.
I want to pick up on that. Yeah, thank you very much for your very comprehensive answer. It sounds like there's a lot of legislative tools that you think are going to help with early detection. I want to pick up on health literacy and education that you talked about, and turn to you, Paula. When people think about chronic respiratory diseases, they may think of conditions like asthma, whether because they had it as a kid or they know somebody with it, but many people actually don't know about COPD despite its prevalence. So it may sound like a basic question, but it's actually quite fundamental. How can we improve awareness of COPD?
Yes, okay. First of all, on behalf of Respira, we want to thank EFA. On behalf of Respira, we want to thank EFA for the excellent organization and for inviting us to be present here. It's a great honor and a great opportunity for us. And Respira means breathe, so let us all breathe better. When we talk about COPD, we must take in mind two important issues, and these are: respiratory system has unique characteristics. It's open to the environment, completely open, and to an access, direct access to environment. The other one is the concept of getomics, and that means for COPD that through the life of a person, the interactions between genetic and environment. Okay, so let us all keep in mind of this when we talk about COPD. So I'd like to begin to that answer with this take-home message. We have made in Portugal a national inquiry that was promoted by Respiratory Portuguese Society in 2022. and the results were frightened because 70% of Portuguese people did not know what COPD is. So we must take this in mind when we talk about COPD. So how can we overpass this? Yes. I think through continuous, persistent actions promoting respiratory health literacy, namely through public information and formation based on scientific and state-of-the-art data, through classical media and social networks. These are very important for information the populations. By training actions for health professionals, namely through primary care, through hospital care, through pharmacies, through medical schools, medical students, and other health-related universities, and for caregivers as well. Okay. And we need also transdisciplinarity team when dealing with wicked problems. Only with multidisciplinary care we can achieve that. Okay. So another issue that is vital is continuous health education in schools, beginning in primary schools, when they are very little, for prevention of primary prevention of smoking, for instance. Okay, and all of these we should have, and we should give priority to the most vulnerable populations. The population is not homogeneous, so we must take into care, especially the older, the poor, the patients with chronic diseases, especially these ones. So I should say we need a deep involvement of policies, national and European policies, to commit for public legislation and financing of respiratory health literacy. Okay, that's fundamental for the prevention of COPD.
I particularly appreciate the point of starting in primary school level. That's a very interesting one. I'd like to build on afterwards.
Yeah. Yes.
I have a few more questions for you, but I'm gonna jump over to you, Svetlana. If you can just turn your mic on and lean it forwards towards you. It's the red button. Perfect. So you mentioned the importance of, providing health literacy for patients, but also for carers, and that's where your expertise comes in, Svetlana. So like many chronic diseases, COPD doesn't affect only the patients, it affects their loved ones as well, who often end up being informal caregivers, part of their caregiving circle. So Svetlana, you're with Eurocares, and so I'm keen to hear from you. What can be done at an EU level to better support informal carers?
Firstly, good afternoon to all of you. Thank you very much for the invitation and for the opportunity to provide the informal carers perspective to this excellent event. Indeed, you are absolutely right that patients of chronic diseases, COPD, sorry, do you hear me now? Yeah. COPD in particular affect not only the person diagnosed with the disease, but also the family and even the extended social circle, friends including. Informal carers assume this role often overnight without any preparation or any training. But I would like first to mention, in case some of you don't know, I represent Eurocares, which is the European Union Association working to promote the interests of informal, or if you want, family caregivers, although informal carers is now the official term used in the EU. I would like to start by highlighting the the informal carers play in sustaining the European health and long-term social systems. I want to give you some numbers because they are staggering. It's estimated that almost 52 million of Europeans provide informal care on a regular basis. This calculated in full-time equivalent means that nearly 80% of informal or unpaid care in Europe is supplied by informal carers. The economic value of this unpaid care is immense. It's estimated between 320 and 368 billion euro annually, which surpasses most member states' own expenditure on formal long-term care. Yet, informal carers often remain under-recognized, not sufficiently supported, and at risk of financial and health-related challenges. So on the question, what could be done at the EU level? There are at least 3 key areas where the European Union can take action to support informal carers. And I will start by first provision of financial and employment support. Many informal carers, particularly women, are forced to reduce their working hours or to leave employment altogether. This has long-term negative financial consequences, obviously, including lower pensions and risk of poverty in the long run. So EU-wide policies could and should facilitate, first, flexible working arrangements for informal carers, paid leave, and pension credits, which will allow them to balance working and caregiving responsibilities. Then, and I thank you, the MEP Julia, for mentioning this, training, information, and respite care. So I already mentioned that often we become informal carers, all of us actually, become informal carers overnight without any preliminary training. Many of us may be forced to assume complex caregiving, administrative, even medical tasks. So it's very important that investing in adequate training programs which train informal carers essential skills is vital. So in addition to what MEP Julia said, training is necessary for the patients, for the health practitioners, but also for the family members who provide, who supply the informal care. Next, respite services could be expanded in Europe so that informal carers can take breaks without feeling guilty or leaving their loved ones without support. And I will also would like to highlight the importance of raising public awareness, because this is the way to ensure that the contribution of informal carers is valued, appreciated in the EU. And lastly, I want to mention the need of integrating informal carers in the healthcare systems. Informal carers should not be seen as invisible presence, but regarded as valuable contributors by the health practitioners. Strengthening primary care and particularly fostering the cooperation between the patient, the informal care, and, for example, the general practitioners can lead to more positive patient outcomes and can also reduce the need for unnecessary hospitalization. And lastly, perhaps I will mention also digital solutions and assisting technologies can also help family or informal carers in their task. So to conclude, the EU must ensure that the invaluable role of informal carers is reflected in all relevant policies.
Sounds like
Healthcare,
education is really the key there.
education,
Yeah.
social protection, and employment. And others.
Absolutely. Thank you very much for that comprehensive answer. And I like that you touched on digital health because that connects nicely to some of the work that you do, MEP Kulia. We've seen that within the world of health policy, there's a growing focus on digital health tools and solutions for a number of diseases, whether it's for education or disease monitoring or communication between patients and healthcare providers. So clearly digital health is really on the rise. And we also see that in the IFA report, there's a recommendation of developing patient-centered digital health strategies. So I'm curious to hear from you, like if you were to design a digital health tool, what would it do? How would you design it? I know I'm asking for a lot in 2 minutes, but we're going to try to, if you can just paint the broad strokes of what that digital tool would do.
Oh, so in 2 minutes, it's really hard to summarize all my thoughts.
Big challenges.
Yes. The most difficult thing that with one solution, you cannot reach everybody, and there is no one solution for everybody. And we mentioned health literacy, and we have to find different solutions. I started my health educational TikTok channel because I witnessed how the devastating effects of misinformation spreading during the COVID, and it can spread so quick that it's really hard to react, especially when there is a pandemic or event like that. And now I have 370,000 followers on TikTok, and I think it's not because my channel is so novel or I did some very new, innovative thing, but because there is a big need in our citizens for a proper and understandable information, health-related information, because they really need information, and we have to find these solutions, how to deliver the proper information and how to convert the science to a very understandable and catchy information package, because that's how we can reach our patients. And I missed one big problem when we talked about diagnostics, that we see the healthcare workforce shortage crisis, especially in CE region, and that's a real problem. In Hungary, about 1,000 GPs are missing from our healthcare system. 1.5 million people out of 10 million do not have proper access to primary care. So, and in 12 European member states, 40% of healthcare workers are over 50. And we have to use the digital solutions to reduce the administrative burden of healthcare workers, to give them more time to talk with patients, to educate the patients, to show those websites, digital solutions where they can get more information to strengthen the trust in our healthcare system. And also we have to communicate more directly, in more understandable way, more quickly, and back to the European Health Database and digital solutions and AI solutions. We need to find those new digital tools with which we can identify those very vulnerable groups, citizens, and yeah, on EU level, we can create policies about to reduce the tobacco usage, to reduce this very catchy flavor tobacco products. It is very important, but and it is crucial. But also with education, we can reach those people who live in a rural region in very poor conditions, and they don't even know many times what is harmful for them, what can cause chronic obstructive pulmonary disease, because it's not only because tobacco usage, but in Hungary and I think eastern part of Europe, they also in winter times use different things to burn to make warm their houses, and this also can be very damaging, and other substances. So with education, we can fulfill those gaps which are not covered now or can be not covered with policy.
So it sounds like digital health tools can both inform people about the risk factors of COPD, as well as educate people who might be at risk of COPD, but also provide further education for people who have COPD about ways to improve their health and to connect them with their healthcare workers, even if they live in areas that might be underserved. So lots of different ways that digital health could play a role in improving the quality of life and the prevention of COPD. We're going to cast our sights to the future, to the horizon. So the report looked at what changed from 2013 to now. So it found that some things did improve, things like access to vaccines, reimbursement of treatment. Those things got better since 2013. But the report appropriately points out that there's a long way to go in a number of areas, including personalized care and treatment for COPD, for instance. So Paula, based on your experiences in Portugal, can you give us the nutshell of what you think the priorities should be for the next decade?
Yes.
I keep asking impossible questions, but
Yes. In 2 minutes?
2 minutes and 30 seconds will be generous.
5 minutes. No,
Not quite.
I'll try to keep it my schedule. Okay. So I'd like you to keep this number in mind. 800,000 people in Portugal has COPD. Okay, almost 1 million people in a population of 10 million. So let us all keep this in mind. Our answer relies on 2 items: prevention and management and care. Okay, so COPD is a preventable disease. So we must take care of the patients now, but we must take a special care in prevention. So that in the next 20, 30 years, we can say that COPD is no more a pandemic, okay? Because it's a pandemic throughout the world, throughout Europe, throughout all the countries. So how can we do this? Let me think. The main message is to, in what concerns the prevention, I should say we in Portugal need to create an integrated and holistic COPD national program and plan with the inclusion of a strong dimension of respiratory health literacy, taking into account the significant regional differences throughout the whole territory. I don't know if this happens in all the UE countries, but we have a population that has major difference from the north to the south, from the interior to the seaside. So we must take that into account. We must have as well make more restrictive legislation regarding smoking. It's of major importance. Portugal is very liberal in what concerns smoking, and especially the new ways of smoking. We could talk about that for hours and hours, but I have 2 minutes. So it's very important. And restrictive legislation regarding as also environment, airway pollution, mainly occupational exposure. This is very important. Another thing that's impacting in the population life is the poor quality of building houses. I don't know if you know, but in Portugal, 1/4 of the people, 25%, have no money to heat their homes. And as you know, cold is strictly lied to COPD, okay, and infections and so on. So this is a quite important thing. I mean, we are talking about eliminating poverty.
A big ask in a decade.
Well, and we want as well maintain primary prevention actions against smoking all over the country schools. That's a major pillar of all of this. And I think we have to redefine our national adult vaccination plan. This is very important because when a COPD patient is infected, exacerbations worsen the prognosis of life. So we must have financing against RSV, respiratory syncytial virus, as well as herpes zoster and high-intensity flu. Nowadays, high-intensity flu dose is only over 85 years old. We want to put it over 65 years old. And to keep 2 minutes, I should say the creation of this COPD national registry. So I'm done.
Thank you very much for that comprehensive answer. It sounds like you would like a national COPD program and registry, that you want to improve access to primary care services, improve access to vaccines, and of course, improve the quality of life generally of people living with COPD so that they can, be healthier, generally speaking, as well. Absolutely. I'm doing a little bit of scanning in the horizon, and I see that we also have with us Respira President, Mr. Jose Albino. I just want to give you an early access to the floor. If you have any quick line to add, please turn on your microphone. We'd love to hear from you as well for what you think should happen in the next 10 years.
I would like thank you again from effort to invite us, and thank you for the Paulo's words. It was fantastic what he said on Respira. She has aboard the problem of the prevention of COPD in the school, but I would like to say something about it. It is very important for us to talk about this because the primary prevention in school, I think, is the best way to put the POCD down in all over the world and in the Europe. Okay, I will say that Respira would like to the new generation to be intend smoke-free. It's a great point, but that's what we work for. We work for this. Then we have a great plan of visiting schools in Portugal, a great plan on the idea, but not many schools, because that's why you want for the parliament, because we want founding for this, because we have no means for the most. But it is a very important place we go, visiting schools to talk to the children before they start smoking. That's our point. We talk to the children who are 11, 12, 13 years old. That's the best way to do it. And the children are fantastic, listening to us, and we go with some of our kids with oxygen, and they start. Yeah, it is very important, and we don't know the results, but we think something will be there. Okay. We are asked to create a network for smoking prevention in schools through the country, but in the local power to improve that, because we have no means to go, and we must with interlocutors from Respira and all around, and to do this. I think it is the best way to prevention is that one. We like to insist the recognition towards the work we do to change behavior and educate on public health with funding for patients' organizations. That's the only way we think we can manage to put the new generation work-free, okay?
Thank you very much, Mr. Jose Albino. I'll give the floor back for 1 minute to Paula.
1 minute.
Wanted to add something?
When I talked about the 10 most important things to do, I didn't talk about care and management. So I should say what we want is an early recognition of COPD symptoms and signs, as well as exacerbations from the patients. And a homogeneous primary care net through the whole country with enough GPs and available spirometry. We want as well need equal follow-up and treatment to every patient, including the access to pulmonary rehab and precision treatment. Precision treatment is very important for COPD severity patients. Okay, so
Thank you very much for adding that.
Thank
It's
you.
one of the recommendations as well from MIFAS to
Yes.
focus on precision treatment. So
Okay.
before we open the floor to broader questions, I'd like to turn our attention to Marianne Taki, who is Acting Head of Unit Disease Prevention and Health Promotion at the European Commission's DG Santé. We're going to be hearing from her about what the Commission can do to improve matters further over the next 5 years. So Marianne, I believe you're connected with us. Let's unmute. And you have the floor for a couple of minutes.
Yes, good afternoon, everyone, and thank you for inviting DG Santé to this important event. We continue to work on lung health at the EU level. It is an important public health challenge, and we need to strengthen the prevention of the onset and progression of chronic respiratory diseases, particularly of COPD. Now, this is of course done in the broader context of non-communicable diseases. They continue to be a major cause of premature mortality, and prevention can avert 70% of the burden of NCDs. The new Commission and its work will be based on the mission letter to Commissioner Varhelyi. And in that mission letter, it is absolutely clear that Commission will step up work on preventive health, ensuring a comprehensive approach to health promotion and disease prevention. We continue to support member states and stakeholders, such as yourselves, in preventing and addressing these diseases through the Healthier Together EU Non-Communicable Diseases Initiative. This initiative was developed in 2022. It covers 5 key areas: health determinants as the horizontal strand, cardiovascular health, diabetes, mental health, dementia, and finally, chronic respiratory diseases. And all these areas or strands have now been addressed through implementation. We have carried out and launched several joint actions, one of them being, for example, horizontally on prevention. It's called Joint Action Prevent NCD. It is led by Norway. And we also have stakeholder-led projects. I'm pleased to say that last week, a new joint action on respiratory diseases, it's called JARED, was kicked off. And it will help to improve lung health across Europe. 17 countries are in it, 14 member states, and also Iceland, Ukraine, and Moldova. 5 million euros have been allocated from the EU for Health program, and the particular focus will be on vulnerable groups and those who need help the most. So for the next 3 years, this joint action will be really important in capacity building in the member states, raising awareness and improving health literacy on lung health in Europe. There are underlying innovative digital health technologies, improving access to diagnostic tools, and enhanced health literacy efforts. And as a final thing I would like to mention, of course, reducing the burden from smoking is important. The Commission will also continue to support effective tobacco control policies and legislation. This will be done in the form of a joint action, which will help Member States to implement a Council recommendation, which was adopted by the Member States in December on smoke and aerosol-free environments. So we hope that with this substantial work and actions, we will be able to support the work of stakeholders, Member States, and also international organizations in addressing lung health and specific diseases like COPD. So with these very short remarks, I would like to finish, and I would like to wish you an excellent continuation of the debate at your end. Thank you very much.
Thank you very much, Marianne. So thank you so much to our panelists, both with us in person and online, for answering our questions and for sharing their time and their expertise. Please join me once more in thanking them before we open the floor to some questions. So I think it's really important that we further include patient voices in our Q&A. So I did a little bit of sleuthing beforehand, and I identified a few individuals whom I'm going to pick on very briefly. I see that you're getting up now, but Jean-Paul, would you be so kind as to share with us some of your insights and any questions or comments you have for our panelists?
Oui, alors bonjour. Nous, patients, on réclame qu'une seule chose, c'est la prescription, comment de...
Do we have interpretation services?
Hein?
Today, the patient asked to have the prescription to physical activity adapted for conditions and prescribed and assured.
Voilà.
For our audience, we have Jean-Paul Vasseur and Lilia Gentet, who are from France. So thank you for providing live interpretation for us.
And once, the second, to increase the price of cigarette for whole Europe, the same level for be rather expensive, and so we can decrease the number of smokers.
Thank you very much. So it sounds like you want to relay the importance of tobacco control policies as part of the work to improve the care and the prevention of COPD. Does anyone want to add anything about tobacco control, perhaps?
I mean,
because you mentioned that as one of your top 10.
That's a role for local policies, government policies, and European policies, because all of us know that smoking is related to financial interests, very important ones. So it's difficult to deal with this. So we must have national programs with national legislation, and taking into account that the new forms of smoking are as dangerous as classical tobacco. Okay, let's keep this in mind.
Thank you very much. It sounds like tobacco control is certainly a theme that's come up both from the Commission and from you. And I see that MEP Kulia, you have something to add as well.
Yeah, I think the link is very clear between tobacco and COPD and lung cancer. So it's clear. What we witnessed in the 1960s, that the company said that there is no enough evidence to say that it's harmful, it causes cancer, and we already the medical doctors and scientists already showed the link, and later on we had the clear evidence. And now I think many companies play the same game, that saying that there is no way, enough evidence, we have to wait, we have to evaluate, but our lung is to breathe in clear air and not to breathe in different substances, because the main purpose is to exchange the oxygen and carbon dioxide. So, and everything what goes in our lungs can cause damage. And for example, in Hungary, all these single-use new tobacco product disposal, vaping products are banned. And I was happy to hear that the same ban in the regulation is now in I think in Belgium since last year, December or November, something like that. But again, education, because yes, we have to control and we have to have very strict regulation, but also to educate people, youngsters, the young population, that how harmful it is and how addictive is the nicotine, and our lungs, as I just mentioned, is for breathing clear air and not damage it with different substances.
Thank you very much for that. I think in addition to our conversation about the environmental risk factors and exposures that can cause and lead to or exacerbate COPD, our conversation wouldn't be complete if we didn't talk about one of the genetic causes of COPD, which is alpha-1 antitrypsin deficiency. And I know that we have with us in the room Frank Willerson, who is a representative from Alpha-1 Europe. And so, Frank, I just wanted to give you the floor for a couple minutes to add any questions or comments that you might have from today's discussion.
Thank you, Madame Berchery. It's very, very kind. As a matter of fact, I'm a patient with COPD, and if you have COPD, well, life is not easy because you have to adapt all the time. And every year or every month, there are new things coming up, and we have to learn a lot, and we have to adapt if we can, and sometimes we cannot. And so we learn for about a couple of years how to handle exacerbations, or we learn about hygiene of life, and we can learn a lot of things, but there is one issue, well, we didn't learn yet. And I'm speaking about palliative medicine and the end-of-life care. I mean, all these millions of COPD people, they will go their way in the next years, but they will suffer. And a lot of them now are afraid to suffocate. And I think we should do something. We should educate COPD patients that life is going his way, and we can learn to accept it if we would like to. And it's not only caregivers, it's so important, and GPs, but it's also the patient who can learn and who should be an element of our issue on public health. Thank you.
Thank you very much, Frank, for your comments and for bringing our attention to an important point, which is continuing life care, not just the diagnosis, but care throughout the life course of a person with COPD. I'd like to open the floor for questions from the general audience, so don't be shy. Raise your hand and I will call upon you, and a reminder to please turn your microphone on. Oh, I see a hand at the very back. Please introduce yourself very briefly and let us know to whom your question or comment is directed.
Thank you so much. Sophie Perrault from the Health and Environment Alliance, HEAL. First of all, huge congratulations for organizing this event. This is so, so important, and it's so timely as well. So really, really big thanks for that. I mean, bringing health to the forefront is never a given, apparently. So it's really, really important. I also wanted to thank so much IFA for their recommendations, because I think that's extremely, extremely valuable. And there's just one that I wanted to highlight a little bit, and then the question will come right after that. It is the one about air pollution at EU level. And so basically, I'm going to make a link with a big topic that is on the horizon, and that is the budget, MFF. So basically, there is a very, very direct link between improving lives and improving the way we spend public money. And the link is, so basically now we have new rules on air quality. They are not exactly as ambitious as we would have liked, because we would have liked to see a full alignment with the WHO recommendations when it comes to the concentrations of air pollutants. But okay, we have a new law. Now it is to be transposed into national law, and this is where the money comes in. So my question actually is to the MEPs in the room, or MEP in the room. Can we count on you to basically really make sure that the next MFF will, first of all, stop subsidizing air pollution? So that means stop subsidizing fossil fuels, that's very clear. But also really shift the money away into investing into prevention from pollution. So this is very simple, this is very clear, and we really need really your support on this. Thank you so much.
A very big question. MEP Collier, if you can respond briefly to that, and we'll take one more question after that.
And the answer is, I think, is even more complex. Because there are so many layers. Because, yeah, this topic is very, very complex, and it is clear that we have to keep our air clear. Sorry, and we need funds for this, and also we have to have a proper regulation for the industry, and also to keep the balance. And I think this is the hardest part of it, because if we try to change everything in 2 years or a very short time period, and we are not cautious and patient enough, then we also can cause more damage and more problems than we solve. For example, with a very immediate and very strict regulation, and by killing the part of the industry, the people will see the economic effect of this, and will question our decisions or the direction. And that's the part where also the education and health literacy comes in. We also, with slow steps, but constantly moving forward, and educating the people, our citizens, can change things in a sustainable way. But we have to find this very fragile balance, how to move in a better direction. And I see that you are a little skeptical, but believe me that people make their decisions not only one or two because of one or two perspectives, but how they live, what they feel, and we should be aligned with this, and we can move forward things only in a slow and digestible way. And I'm very committed to move Europe in a more sustainable and more green and more healthy direction. But also, so I'm a newly elected MEP, I'm still learning and analyzing what is the best solution. How can we do this in a sustainable way, and not to try to act fast, but at the end witnessing that it backfires. So I think the question is the key core of this thing, to keep the balance and keep moving in a greener and healthier Europe.
It's a big question to tackle in such a short amount of time. Perhaps over a cup of coffee at another time, or in a longer discussion, would it be a way to continue this conversation? I will take one last question before concluding remarks. I thought I saw a hand in the back over here. There was a hand earlier. Is it? I think you had your hand up earlier, yeah, when I was scanning the room. Yes.
It's more a comment than a question. My name is Pascal Garel. I'm the Chief Executive of the European Hospital and Healthcare Federation. that gathers 37 national organizations of hospitals and healthcare services in 30 countries in Europe. And we are also working closely with Ukraine and Moldova. That makes even more countries. So congratulations, Eva, for the event. It's also very timely for the same reason you mentioned, because we also really concerned about the air pollution in general. Congrats to also MEP Kulia, because of the work you do in your country. I mean, that's amazing, and we have been following you before, thanks to our Hungarian colleagues who made you aware. You mentioned that digitalization. Actually, we're working on a project like this, thanks to the EU funding, research funding Horizon. It's a project called Resample, and we're working with patients, with academics. When I mean academics, it's also artificial intelligence researchers, all kinds of professionals, psychologists, and so on. And as I said, with patients, because the main goal of this project is to make a digital tool, considering all the difficulties with literacy, digital tool easy to handle. And we're testing with very different countries in Europe, very different cultures and knowledge about that. The important point we always raise in this project is multimorbidity. The core group is COPD, but which also trying to tackle the issue that those patients have other diseases. And that's very important all for us. And it's the core of the work we're doing. So we'll provide information to IFA to circulate. The project is closing in a few months, so we have the results already, and we'll present it in several audiences. But I thought it was very nice to mention that. Yes, it's a research project, and it's nice to hear Marian Taki from European Commission saying that there's a broader view to integrate that in a more development level than only research. So that's a modest contribution I wanted to add to this very, very huge issue of COPD.
Thank you very much, Pascal. Yeah, it sounds like health literacy and digital tools are certainly common threads that everyone is interested in developing further, and perhaps we can have another conversation focusing on those two elements in the future. But for today, that is all the time that we have. Thank you to our audience members, both in person and online, for your engagement, and for those in person for your questions. And a big thank you to our panelists and our speakers for their insights and their time. Please join me in thanking them. We covered a lot of ground today, and while it's impossible to distill it all, there are a few things that stood out to me from every contribution. So we started off with Marcia setting the stage with some key calls to action, including her focus on prioritizing funding research on lung health to match the scope of the prevalence of COPD. Given how prevalent it is, she is appropriately calling for more funding for research on COPD. MEP Jurkovic pointing out the singular importance of early detection and how that could be organized at a national level, using Croatia's national lung cancer screening program as an example of how that might be done. And in her address, MEP Metz really highlighted the extent to which COPD can be prevented as well, and why it's vital to address environmental risk factors in addition to tobacco as a risk factor. And during the panel, MEP Kulia, you highlighted the various European Parliament policies that can improve early detection, but also the ways that digital tools can help us improve health literacy. And again, that theme that has come up many times, health literacy. Paula, you really emphasized the importance of COPD awareness, and you highlighted the various strategies and tools that you use through your work, whether through traditional media or social media, to improve the public's knowledge of and their understanding of COPD. And Svetlana, you really served as a key reminder that COPD does not just affect patients, but it affects whole communities of informal caregivers who are just as affected by the disease and who need to be taken into consideration in the policies that we build at an EU level and at a national level. And Marianne from the Commission also highlighted the joint actions that, again, increase health literacy through digital tools and the Commission's important work on tobacco control. We certainly hope that you found this policy roundtable as useful as the recommendations that are highlighted in the Raising the Bar for Better Standards on COPD Care report. And there's no doubt that there's a lot of work to be done, but we also have to acknowledge the work that has been done. And we also have to give a big thank you to those already working to improve matters for patients with COPD and their loved ones. So first, thank you to the reinstated MEP Lung Health Group for drawing attention to these issues in the Parliament. And thank you to the European Lung Health Group representatives for being with us in the audience, to the IFA members, and to the IFA team behind the scenes that put this fantastic event together. Thank you as well to the technical crew who are here at the European Parliament supporting our event, and to our in-person and online audience for joining and participating and using the hashtag if you did. And last but certainly not least, thank you to IFA's sustainable corporate partners, AstraZeneca, Roche, Sanofi, and Regeneron Alliance for their unrestricted grants in support of IFA. And of course, most importantly, thank you to our patient advocates for leading the way forward. That is the biggest thank you of them all. Before we part ways, I encourage you to go get a free lung test. We heard about spirometry and how important it is to make it as accessible as possible. There is no more access than just here in the European Parliament. So you can go and get your lung testing done. It's available till 6 p.m. today at Spinelli Floor 1 in Balcony Area 1G. So we really do encourage you to check it out. And it's a free lung test put on by Lungs Europe exhibit. And with that, I thank you for the privilege of moderating this conversation, and I thank you for your time and for your engagement, and we look forward to speaking with you next time. Thank you.